mentioned how do we diagnose somebody as hypertension when are they finally going to be a hypertensive patient. Now, how important is it for them to start medication and stay on that medication?
Right. Why is it important
Right.
to maintain a certain blood pressure level? I'm sorry. So if you keep your blood pressures less than 140 systolic and less than 90 diastolic, the future risk of heart attack, paralytic stroke, kidney failure requiring a dialysis, all that can be minimized or prevented.
Right.
So it's imperative that we manage our blood pressures below this level. So what are the measures we take? First is preventive measures. When I'm not diagnosed with hypertension, that's when my job starts. I should not become hypertensive.
Right.
So start eating responsibly, exercise well, maintain my body, what we call waist-hip ratio.
Right.
Weight is very, very crucial. But once my pressures are reaching somewhere which is called hypertensive, the first intervention, we still give it to lifestyle and diet.
True.
We do not start medications immediately. That's why there's a term called pre-hypertension. Between 120 systolic to 140 systolic, we call somebody pre-hypertensive. Means you are going to be hypertensive, please start mending your ways now, otherwise you will get into the next zone which is more hazardous.
True. Very true.
So once we diagnose somebody with a hypertension, not controlled on lifestyle, then we initiate medications. See, medications is one of the most beautiful things that happen to mankind again. After fruits and vegetables, if they are prescribed medications by a specialist, not over the counter or non-qualified people.
Right.
Because like in fruits, like in tubers, like in any of the Ayurvedic medicines, these medicines, prescribed pills, also contain chemicals. These are all chemicals. Right. They're used for different reasons. If they augment your health, they augment your health, so they're your friends. All of us brush our teeth every morning, it's fluoride, right? So most of us don't have any disease. Why do we do it? Because we don't want to decay our teeth early.
Right.
Most of us use soaps on the skin or moisturizers. They're also again glycerin and other components.
Right.
But they preserve your skin's health for a longer duration.
True.
But what are we doing when it comes to your heart, kidney, vision, brain? Are we doing something to preserve their health for a longer duration? I think these do when they are required and prescribed by a specialist.
Very true. So it's very important for them to be compliant on their medication without missing the dosages and making sure that they follow up. Just because you've been diagnosed with a hypertensive medication 10 years ago doesn't mean you don't follow up routinely.
Sure.